for standard of care for Duchenne's, we have started on the approach for multidisciplinary clinics, and that is encouraging to see that we are getting more and more multidisciplinary clinics across the country. The next is evolving into more interdisciplinary teams that is more team-based and focused on providing patient and family-centered care, such that we have a patient that comes and have various providers who work together as a team, as opposed to pretty fragmented care where they go to multiple providers with difficulty of communications amongst the providers to connect the dots, so to speak, and help them navigate their health needs that are usually complex. We have the goals with a interdisciplinary integrated care approach to provide holistic care, such that we would like to improve the patient outcome and also at the same time improve the outcomes of the population of Duchenne patients as a whole. And that usually generates a lot of improved patient and family experience as they have expressed the satisfaction with such an approach that usually helps them navigate the whole system with a so-called medical home setup. And this medical home setup really comprises the team captain that it's usually the neuromuscular specialist who not only wears the hat of the neurospecialist in the prescription of mutation-specific medications or Duchenne-specific medications, but also help coordinate the care needs of the patients in terms of organizing the support for the cardiac, the pulmonary, the general endocrine, and the other health aspects of ortho needs as well. So you do have a system whereby you have patients with the needs as themselves at the focus, with the fact that you have then the other supporting players who may be geographically distant, but basically connected through this whole integrated care system, with the fact that the patients, the families, and the primary care physicians, they work closely with the neuromuscular team and coordinate the care needs. So basically that is the dream, I believe, for every clinic, because it can actually enable the care of patients from the time they're diagnosed all the way to adult stage, and knowing their history really well for continuity of care. And that certainly is going to be a boost for better outcomes as well and better family satisfaction. And with regards to the example of connecting the dots in getting new providers to be involved in the care of these patients, our experience with the encountering the renal dysfunction as we monitor our patients into the late teens and early 20s is the emergence of the potential renal problems as a result of cardiac dysfunction, what we term the cardiorenal syndrome. And that enables us to work closely with another specialist colleague who usually doesn't come into the care team, but now we do work closely as they have to work with recommending to the cardiologist the titration and the changes of cardiac mats in order to preserve the renal function. So there's a lot of new approaches, I believe, as we care for these patients at this point in time, until a point when we're able to have a cure or a treatment in the early stage Duchenne patients, where you arrest the disease progression and you probably don't need that team after that. But But certainly up till then, this will be the task ahead of us.